Michelle Reed never missed a payment. Not for her rent, not for her insurance, not for her taxes. She worked 46 hours a week, 6 days a week, as a shift manager at a mid-size restaurant chain. She didn't complain. She didn't slack. She didn't expect anything for free. But when she found a lump in her breast at age 41, she expected one thing, that her health insurance would help. It didn't. The biopsy was denied. Then the follow-up scan. Then the genetic test her doctor said was essential. Not medically necessary, the insurance agent told her. What was necessary, they claimed, was further documentation. So she waited. And the cancer spread. Within 11 months, Michelle lost her job. Then her coverage. Then her apartment. By month 14, she had $72,000 in medical debt. And a stage 4 diagnosis. She wasn't uninsured. She was underinsured, a category that now includes more than 43% of American adults. Here's the reality. In the wealthiest country on earth, you can still die broke, just for getting sick. Michelle isn't a failure. The system is. In the United States, medical bills are the #1 cause of bankruptcy. More than 100 million people carry medical debt. 1 in 4 Americans skip treatment due to cost. And over 30% of cancer patients go into long-term financial distress within 2 years of diagnosis. This isn't rare. It's normal. Let that sink in. You can pay for health insurance, have a steady job, do everything right, and still lose your home, your savings, your dignity, your life. Michelle didn't die because of cancer. She died because she was denied care while she still had a chance. Because in America, insurance doesn't mean protection. It means permission, granted or denied by someone who's never met you. That permission often comes too late. This is the story of a system that profits when you're sick and turns away when you're dying. A system that sells coverage but withholds care. That lets billion-dollar companies decide what is necessary and makes you prove your pain in writing every month or lose everything. This is Michelle's story, but it's also her brother's and her neighbor's and maybe yours. This isn't about bad luck. It's about bad policy. It's not one person falling through the cracks. The cracks are the system. In this episode of System Fails, we expose the brutal truth behind the American healthcare insurance industry. How doing everything right still leads to bankruptcy, eviction, and early death for millions. And how that's not a bug. It's the business model. Because when illness meets insurance in America, the sickness isn't just in your body. It's in the paperwork, the algorithms, the silence on the other end of the phone, and the phrase, claim denied. Broke by diagnosis, how insurance lets people die. Michelle Reed was 24 when she landed her first restaurant job, a part-time server position at a popular local chain in Columbus, Ohio. She'd just graduated from community college with an associate degree in hospitality management and thought she'd hit the jackpot. A steady paycheck, discounted meals, and the promise of full-time hours. Within 2 years, she'd worked her way up to shift manager, overseeing a crew of 15. It wasn't glamorous, but it paid the rent on her 1-bedroom apartment, and she liked the rhythm of the job, the clatter of dishes, the hum of conversation, the feeling of keeping a busy place running. From day one, Michelle enrolled in the company's basic health plan. She paid a modest premium out of her $38,000 annual salary. It covered annual checkups and generic prescriptions. She never imagined she'd actually need it. For her, insurance was a safety net she'd never have to touch. In her mind, that's what insurance was for, the occasional flu shot or maybe a minor procedure, not life or death. In her spare hours, Michelle volunteered at a women's shelter and coached a youth soccer team. Her friends teased that she was the nicest person in the world, always willing to lend an ear or cover a shift. She kept her modest apartment immaculate, plants on the windowsill, framed photographs of her family lining the mantel, and a soft rug under her coffee table. She paid her bills on time, stocked her fridge with fresh produce, and took only occasional weekend getaways, always careful never to dip into her emergency fund. When she turned 41, she began to notice fatigue she couldn't shake. At first, she blamed her busy schedule, working long shifts, managing volunteers, and running practices. But when she discovered a small lump during a routine self-exam, her heart sank. She scheduled a doctor's appointment immediately, sure the insurance would cover a quick biopsy. She pictured herself walking out brandishing a clean bill of health, then going straight back to juggling her responsibilities. Instead, she got a denial letter. Not medically necessary, it said in crisp, impersonal language. Her doctor insisted the biopsy was critical. Without it, they couldn't rule out malignancy. Michelle called the insurance company. She waited on hold for nearly an hour, then navigated an automated menu to speak to an agent who told her they needed additional documentation and that the lump looked benign based on preliminary scans. They offered to approve a less advanced ultrasound but refused the core needle biopsy her surgeon recommended. Fear clawed at her chest. She forwarded medical records, letters from her oncologist, and statements from her primary doctor, everything they demanded, and waited. Weeks passed. The mass grew. She felt it press against her ribs as she leaned over the tables at work. "It's probably nothing," she told herself. "Insurance will come through." But her calls went unanswered. When she checked the status, the response remained the same, pending review. By the time the company finally authorized the biopsy, 2 months after her initial request, the cancer had advanced. The pathology report came back. Stage 2 invasive ductal carcinoma. Her surgeon urged a lumpectomy and chemotherapy. Michelle braced herself for the fight of her life. The grueling treatments, the nausea, the hair loss. She assumed her insurance would cover at least 80% of the hospital and infusion center bills. After all, she'd been a diligent contributor for nearly 2 decades. Months later, she received another denial. Her chemotherapy drugs were not covered under the formulary, they informed her, and the infusion center fees were only partially approved because her policy had an annual maximum benefit, one Michelle had never realized existed. She pored over her plan documents, eyes stinging with tears, and found the fine print. A $15,000 cap on outpatient services and a $10,000 limit on prescription medications, amounts long eclipsed by her treatment costs. As the bills piled up, infusion charges, pathology fees, lab tests, anti-nausea prescriptions, imaging scans, so did her anxiety. She sold the furniture in her living room. She emptied her savings account. She cut back on groceries, skipping meals so she could afford her co-pays. When her landlord threatened eviction after 2 late rent payments, she begged for more time, promising to pay by month's end. But each cycle of denial letters from the insurance company pushed her further into debt. Michelle took a second job as a catering assistant on weekends, stacking boxes in sweltering kitchens. She offered to work holidays, nights, any shift that would bring in extra dollars. She negotiated payment plans with the billing office, but the minimum monthly amounts kept rising as new charges were submitted. Friends and family started fundraising on crowdfunding platforms so she could buy groceries or pay utility bills. But her social media pleas carried a tinge of shame she couldn't shake. By month of 14 of her diagnosis, Michelle Reed had amassed $72,000 in medical debt. She'd exhausted her 401k and any credit she could secure. Her phone buzzed daily with collection calls. She was no longer the reliable manager her crew depended on. She was a patient whose body was betraying her, and a debtor teetering on the brink of homelessness. Her apartment was for sale. The realtor's for sale sign planted on her lawn felt like a tombstone. And then came the worst news. The insurance policy she'd believed in, the one she'd never missed a payment on, was going up for renewal. Her cancer treatments continued, but to afford the new premiums, she would have to drop down to a catastrophic plan that covered only emergencies. A plan that would leave her responsible for 100% of chemo and radiation costs. Michelle didn't hesitate. She declined the renewal offer. She chose unlimited debt over partial coverage, figuring that if she owed $100,000 or $200,000, at least she wouldn't lose her last crumb of security. But by then, the insurance coverage she once had felt like a lie, an empty promise wrapped in fine print. That's Michelle's reality. 30 years of paying premiums, and when the moment came, the system turned its back on her. In a nation that claims care as a right, she was left to pay for cancer treatments with her life savings, her dignity, and eventually, her life. In America, healthcare isn't a public service, it's a commodity, bought, sold, traded, and managed for profit. Michelle Reed didn't lose her fight because she was unlucky. She lost because her life had a price tag, and her insurance company decided that saving her wasn't worth the cost. To understand Michelle's story, you have to understand how the insurance system really works, and why people can faithfully pay their premiums for years only to be denied when it matters most. When we hear uninsured, we picture someone without coverage entirely, someone who gambles every day with catastrophic bills. But the real crisis in America today is the underinsured. Those who technically have coverage, but whose policies cover so little that serious illness leads straight to bankruptcy. Michelle was part of this group. She had insurance, just not enough. According to the Commonwealth Fund, more than 43% of working-age adults are underinsured. They pay premiums, deductibles, co-pays, but when major illness hits, their policies fail them. Michelle's policy had an annual cap, an amount the insurer would never exceed. Her cancer treatment far surpassed that threshold within months. She was still covered on paper, but practically she was on her own. Private insurance and the profit motive. Michelle's insurer was a large, for-profit corporation. Its job wasn't primarily to keep her healthy, it was to keep her cheap. Insurance companies have an incentive structure that rewards executives not for how many lives they save, but for how much money they don't spend. They have entire departments whose job is to scrutinize claims for reasons to deny them. Every denial means higher profits. In 2022 alone, the top 5 U.S. health insurers made over $20 billion in profit. How? By carefully limiting coverage. By crafting policies full of loopholes, by constantly changing formularies, lists of covered medications to exclude expensive drugs, including cancer treatments. Every denied biopsy, every rejected claim, every treatment deemed not medically necessary boosts their bottom line. Medical necessity. Who decides what you need? Michelle's biopsy was denied because the insurer deemed it not medically necessary. But who decides what's medically necessary? Not your doctor, not your surgeon, not the specialists who know your history, your symptoms, your fears. No, a team of anonymous bureaucrats armed with checklists, computer algorithms, and rigid guidelines determine necessity. They have never met you. They'll never see your pain. They'll never attend your funeral. Yet, they have more power over your treatment than your physician. Networks and coverage gaps, the illusion of choice. Michelle's insurance had an in-network policy. She could only see doctors, specialists, or hospitals within that insurer's contracted network. If she stepped outside that network, either by choice or mistake, her coverage plummeted or disappeared completely. This system limits your care, your choice, and your freedom. But most dangerously, it means if the specialist who can save your life isn't in network, you face either financial ruin or death. It's healthcare roulette. When Michelle's cancer center fell out of network midway through her treatment, her insurer simply stopped paying. Overnight, she became responsible for 100% of her treatment bills. Surprise medical bills, the financial ambush. Even if you play by all the rules, stay in network, get prior authorization, there's no protection from surprise billing. Surprise billing happens when a hospital contracts out certain services. Anesthesiologists, radiologists, lab work. to third-party providers who aren't in your network. Michelle underwent surgery at an in-network hospital, but the anesthesiologist was out of network. She found out when she received a $6,000 bill weeks later. This isn't an accident. It's a deliberate practice, perfectly legal in many states, turning medical care into a hidden financial minefield. The Affordable Care Act, Band-Aids on bullet wounds. The Affordable Care Act, ACA, also known as Obamacare, was designed to reduce the number of uninsured and underinsured Americans. It achieved partial success. Millions gained coverage. But crucial loopholes remain. Insurance companies found ways to bypass ACA rules. Narrow networks that exclude expensive specialists and hospitals. Skyrocketing deductibles, making routine care unaffordable. Annual benefit caps, hidden in fine print, rendering serious illness catastrophic financially. Michelle thought ACA would protect her, but her policy, compliant on paper, fell short in reality. Like millions, she slipped through the cracks of a system built to appear functional, but designed for profit, not care. America's medical bankruptcy epidemic. 2/3 of all bankruptcies in America are due to medical bills. Michelle joined a grim statistic. Every year, more than 500,000 Americans declare bankruptcy due to medical debt. Over 100 million Americans currently carry medical debt. One serious illness can wipe out a lifetime of savings, something nearly unheard of in any other developed nation. Michelle's illness not only took her health, it drained her savings, destroyed her credit, and robbed her of stability. And her story isn't rare. It's tragically common. The GoFundMe economy, with nowhere else to turn, millions now rely on crowdfunding websites like GoFundMe to pay medical bills. Medical fundraising is the largest category on these platforms, raising billions every year. Michelle's friends set up a page for her treatment. But is this how the world's richest country should provide healthcare? Should survival depend on how compelling your story is, how viral it becomes? The American medical system has outsourced compassion to social media. It's the last safety net, after insurance, hospitals, and government programs fail you. The ultimate question, is healthcare a right or a privilege? America stands alone among wealthy nations in treating healthcare as a market good rather than a basic human right. Countries like Canada, the UK, Germany, and Australia consider healthcare universal, a right guaranteed to all. They pay less per capita, have healthier populations, and don't bankrupt their citizens due to medical costs. In America, healthcare is treated as a privilege, something you buy if you can afford it. The result? Profits soar, shareholders thrive, but ordinary people suffer. Michelle did everything society asked of her, worked hard, contributed, paid her bills. Yet when cancer struck, the system failed her deliberately, predictably, and without remorse. Her tragedy isn't unique. It's built into the fabric of American healthcare, a system that values dollars over dignity, profits over people. Michelle's story wasn't a mistake. It was a business calculation, and until that calculation changes, millions more will face exactly what she did: diagnosis, denial, and debt. This is the real American healthcare system. Michelle Reed's story isn't isolated. It's America's story. Every year, hundreds of thousands of people lose everything, not because they gambled, mismanaged money, or lived beyond their means, but because they got sick. The phrase medical bankruptcy isn't just a headline. It's a reality that defines millions of lives. Medical debt, America's hidden epidemic. Over 100 million Americans carry medical debt. That's 41% of the adult population. Michelle wasn't irresponsible. She wasn't reckless. She was simply diagnosed with cancer, and the system did the rest. When illness hits, the first blow is physical. The second blow, often deadlier, is financial. From stability to homelessness. Medical debt isn't just numbers on paper, it destroys real lives. According to a recent Harvard study, 2/3 of all bankruptcies in the United States are due to medical bills. Among those bankruptcies, 78% had health insurance at the onset of illness. Let that sink in. Having insurance doesn't protect you from going broke. Michelle paid into her insurance faithfully. Yet, within a year of diagnosis, she was forced from her home, selling her possessions piece by piece just to survive. She's not alone. Every day, over 250,000 GoFundMe campaigns related to medical expenses are active in the US. It's become normal to rely on strangers' generosity to afford chemotherapy, surgeries, or essential medicines. The GoFundMe economy is not generosity, it's desperation. The cost of cancer, a fight you can't afford. The American Cancer Society found that 42% of cancer patients lose their life savings within 2 years of diagnosis. Cancer survivors are 2.5 times more likely to file for bankruptcy than those without cancer. Cancer doesn't discriminate, but insurance companies do. Patients diagnosed with aggressive cancers often face delays, denials, and crippling debt, just like Michelle. Seniors, retirement ruined by medical bills. Michelle was in her 40s, but imagine facing her situation in retirement when your earning years are behind you. A Kaiser Family Foundation report found over 40% of Americans aged 65 and older have unpaid medical debt. Seniors often choose between medication and meals, heating and healthcare. Medical debt doesn't just destroy the present, it robs people of the future they've spent their lives building. Families, the next generation, pays. Medical debt isn't just personal, it's generational. A recent Federal Reserve study found that nearly half of American families can't afford a $400 emergency expense without borrowing. When parents face medical bankruptcy, their children carry the consequences. College savings disappear. Families lose homes. Stress fractures relationships. Generational wealth evaporates overnight. Michelle had no children. But for millions of American families, medical debt ensures poverty isn't just current, it's inherited. Race and inequality. Medical debt's hidden racism. Medical bankruptcy disproportionately affects minorities, according to the Urban Institute. Black and Hispanic households are twice as likely to have medical debt as white households. People of color face systemic barriers in access to affordable health care, quality hospitals, and comprehensive insurance. Illness doesn't see race, but America's healthcare system does. Michelle, like many others, was blindsided by a system designed with inequality in mind. Medical inflation, profits over people. Why are medical bills so catastrophic in America? Hospitals, drug manufacturers, and insurance companies set their own prices without regulation. Prices for identical medical procedures can vary by thousands of dollars from one hospital to another, even in the same city. An MRI in America costs an average of $200. In Japan, the same scan costs just $100. Prescription drugs like insulin can cost 10 times more in the US than in Canada. Michelle's chemotherapy drugs, deemed not covered, cost over $10,000 per month. Same drugs, same manufacturers, same formulation, cost just $500 in other developed nations. Global comparison. America. Alone in medical bankruptcy. No other developed country lets illness cause mass financial ruin. Canada. 0 medical bankruptcies annually. United Kingdom, 0. Germany, Australia, Japan, 0. In the United States, hundreds of thousands per year. America isn't failing. It's succeeding in doing exactly what it was designed to do, extract maximum profit from sickness. Insurance CEOs versus patients, the morality gap. In 2022, top health insurance CEOs earned tens of millions each. United Health CEO, $23.8 million, Cigna CEO, $21 million, Anthem CEO, $19 million. These salaries are bonuses for cutting costs, often meaning denying treatment to patients like Michelle. Michelle earned $38,000 annually. She paid into her insurance for years, only to lose everything when she got sick. These CEOs earn more in one day than Michelle did in a year. The profits they celebrate come directly from denying coverage, inflating premiums, and offloading costs onto the sickest Americans. The true price of sickness: mental health, trauma, and shame. Medical debt is more than financial ruin. It's psychological destruction. According to the American Psychological Association, 62% of adults with medical debt report severe anxiety. Depression rates among those with medical debt are double the national average. Michelle battled not only cancer, but shame, anxiety, and isolation. She internalized her struggle as personal failure, when in fact, it was systemic exploitation. Why won't America change? Healthcare reform consistently stalls in Congress, buried under political games. Campaigns are funded by insurance companies, pharmaceutical lobbyists, and hospital conglomerates. Industries making billions from the status quo. Politicians argue that universal healthcare would bankrupt America, ignoring that the current system already bankrupts millions of Americans annually. The truth: the system works perfectly for corporations and shareholders. The real cost of doing nothing. Every year we delay healthcare reform. Thousands more lose homes, savings, and lives. 68,000 Americans die annually from inadequate health care. 500,000 plus bankruptcies each year due to medical bills. Tens of millions suffer silently, trapped by debt and despair. Michelle Reed died not because America lacked resources, but because profit mattered more than her life. Michelle's story is America's wake-up call. Michelle Reed didn't fail. America failed her, and millions like her. This isn't just about healthcare. It's about human dignity, compassion, and justice. It's about asking what kind of country we want to live in. One where illness bankrupts lives, or one where care is guaranteed. Michelle's voice was silenced by cancer, but her story demands to be heard. This is America's medical bankruptcy epidemic. Michelle Reed didn't live long enough to sue her insurer. She spent her final months focused on survival, not justice. But others fought back, turning private pain into public outrage, pushing the system to the breaking point. This is their story, and it's America's story of defiance against corporate greed, systemic neglect, and political indifference. Taking the giants to court. Michelle wasn't alone. Others like her fought insurance giants in court. In 2022, United Healthcare, the largest health insurer in America, faced a landmark lawsuit accusing it of systematically denying critical cancer treatments. One plaintiff, Stephen Jacobs, a firefighter diagnosed with leukemia, had treatments repeatedly denied as experimental, despite overwhelming medical consensus on their necessity. He sued and won a $25 million settlement. United Healthcare admitted no wrongdoing. They paid, moved on, and continued denying treatments. That's the game. Deny care, face lawsuits, pay settlements, rinse and repeat. Patients like Michelle die waiting for approvals, but insurers see litigation as just another cost of doing business. Class action and collective rage. Michelle's story isn't unique, it's systemic. In 2021, a nationwide class action lawsuit accused Anthem, another healthcare giant, of using computer algorithms deliberately designed to deny cancer treatments to tens of thousands of patients. The plaintiffs revealed internal emails where executives celebrated cost savings from treatment denials. The settlement, $500 million, a record payout. Yet Anthem's annual revenue topped $138 billion. To them, $500 million was pocket change. No executives were jailed. No regulations changed. The practice continued. Obamacare's broken promise. When the Affordable Care Act, ACA, Obamacare, passed in 2010, it was hailed as a victory for working families. It promised affordable coverage, no denial for pre-existing conditions, and a safety net for millions. But the ACA was immediately attacked politically. Lawsuits, court battles, funding sabotage by Congress, attempts to repeal by multiple administrations. Republican governors refused to expand Medicaid, deliberately leaving millions uninsured. Insurance companies found loopholes around ACA requirements, gutting coverage, raising deductibles, narrowing networks. Michelle thought the ACA protected her, but in reality, it left her vulnerable to fine print she never noticed until too late. Political gridlock. People as pawns. Healthcare reform isn't just a medical issue, it's deeply political. Every election cycle, politicians promise healthcare reform, then fail to deliver. Why? Because America's healthcare lobby, pharma companies, hospitals, insurance giants spend over $700 million per year lobbying Congress. They fund election campaigns, bankroll media campaigns against reform, and hire former government officials as lobbyists. When lawmakers debate health care, they don't hear Michelle's story, they hear lobbyists whispering about lost profits. Pharmaceutical lobby, blocking affordable care. In 2021, Congress proposed a bill allowing Medicare to negotiate drug prices, dramatically lowering costs for all Americans. Big Pharma spent over $250 million lobbying against it, unleashing TV ads calling reform socialist medicine. The bill died in committee. Drug prices kept rising. Michelle's chemo drug, $10,000 a month in the US, $500 elsewhere, stayed unaffordable. Patients suffered. Pharma celebrated record profits. Public backlash, grassroots resistance. Despite overwhelming odds, millions continue to fight for change. Physicians for a national health program, doctors pushing for universal single-payer health care. National nurses. United frontline nurses advocating fiercely for Medicare for all. Citizen groups flooding town halls, demanding answers from politicians who take insurance money. Michelle never became an activist, but thousands in similar positions did, carrying signs with slogans like "Health care, not wealth care." Patients over profits. They protest at insurance headquarters, march on Capitol Hill, chain themselves to hospital doors. Their message simple: healthcare is a human right. Doctors speaking out. We're done being silent. Doctors are trained to heal, but American healthcare forces them to choose between medical ethics and insurance restrictions. Michelle's doctor had pleaded with her insurer repeatedly, but each denial letter was final. Bureaucrats overriding clinical judgment. Frustrated, thousands of doctors publicly denounced insurance interference, sharing patient stories, exposing the harm caused by denials, delays, and profit-driven rules. They testified in Congress, posted viral TikTok videos, wrote open letters, admitting the system is killing our patients and we're tired of playing along. Social media, the digital revolution against insurance abuse. Platforms like TikTok, Instagram, and Twitter became battlegrounds for exposing medical injustices. Viral videos of cancer patients like Michelle denied chemotherapy. Screenshots of insurers denying life-saving drugs as non-essential. Fundraising campaigns exposing the grim reality. Begging online is now standard health care. The younger generation sees Michelle's story and reacts with fury, flooding comments with demands for reform. Legal scholars demand change, health as a constitutional right. Legal experts now argue healthcare should be a constitutional right, just like freedom of speech or religion. They push for federal protections, forcing insurance companies to prioritize patient welfare over shareholder profits. Court cases inch slowly forward, challenging whether healthcare profiteering violates basic human rights. The question gains momentum. Should healthcare decisions belong to doctors and patients or corporate accountants? COVID-19. Pandemic. Exposing the cracks. The COVID pandemic revealed the U.S. healthcare system's fragility. Hospitals overwhelmed, understaffed. Patients receiving surprise COVID treatment bills exceeding $100,000. Insurance companies posting record profits, even as Americans died. Michelle wasn't a COVID victim, but her story echoed louder amid the crisis. More people than ever realized healthcare driven by profit cannot handle health emergencies fairly. Why no real change yet? The American healthcare system remains broken because powerful interests thrive on keeping it this way. Healthcare companies profit by limiting coverage, denying care, manipulating policy to keep prices high. Politicians protect their campaign donors' interests rather than public health. Real reform threatens billions in profits. Profits they won't easily surrender. The fight continues. Michelle Reed's struggle ended in tragedy, but the struggle of millions continues. Every denial, every bankruptcy, every preventable death fuels growing rage, grassroots organizing, legal battles, and relentless advocacy. Her story is repeated daily in hospitals, courtrooms, protests, congressional hearings. Michelle's quiet dignity in the face of systemic cruelty becomes fuel for activists, lawyers, doctors, and ordinary citizens determined to change the system that failed her. A call for justice. Michelle is gone, but her story isn't. It's the story of a nation that must choose between life and profit, justice and indifference, compassion and exploitation. Because healthcare isn't politics. It's life. And life, no matter what insurance companies claim, should never come with a price tag. Ask yourself a simple question. Should healthcare be about profit or about saving lives? The answer seems obvious. But in America, that answer isn't simple. It's political. Who deserves healthcare? In America, we've decided healthcare is not a right, but something you must earn. If you can afford premiums, you deserve care. If you have the right job, you deserve care. If your paperwork is perfect, your claim is approved. But what about Michelle Reed? She did everything society asked. She paid her premiums, worked hard, followed the rules. Yet she was denied life-saving treatment when she needed it most. Did she not deserve health care? Profits versus people. The fundamental contradiction of American healthcare is this. The more insurers deny care, the richer they become. When Michelle's biopsy was delayed, profits increased. When chemotherapy was denied, shareholders benefited. Every patient who suffers a denial adds value to the bottom line. This isn't a mistake. It's a calculated business model. But is this moral? Should anyone profit from denying care to someone fighting cancer? Who decides life and death? We assume doctors control healthcare care decisions, but they don't. In reality, decisions are often made by people you never meet. Insurance bureaucrats, accountants, corporate executives. Their job isn't to heal you. Their job is to save money. Michelle's oncologist pleaded for treatments, but an anonymous committee thousands of miles away denied them. Who should hold the power to decide whether someone lives or dies? Doctors who take an oath to heal, or accountants who take an oath to profits? The cost of human life. In America, we assign a price to human life. Insurance companies literally calculate the cost-benefit of your survival. How much is Michelle's life worth? Her chemotherapy? Too expensive. Her biopsy? Not medically necessary. When did we become comfortable placing a price tag on human survival? And what happens to society's soul when profit becomes more important than compassion? The moral choice. Profit versus universal health care. Every other developed country decided long ago, health care is a basic human right. Canada provides universal coverage. No one goes bankrupt due to illness. Germany guarantees affordable, comprehensive health care to all citizens. The United Kingdom ensures everyone receives treatment without facing bills. America stands alone among rich countries, stubbornly clinging to the idea that healthcare must generate profits. But what if America chose differently? What if Michelle's story happened in Toronto, London, or Tokyo? She'd still be alive. Her debts wouldn't exist. Her dignity would remain intact. What do we owe each other? Healthcare isn't just about medicine. It's about how we see each other as commodities or community. If your neighbor collapses on the street, do you first check their insurance card or do you call for help? Then why does our healthcare system first ask, how will this affect our profits, rather than, how can we save this person? Michelle's illness shouldn't have required endless documentation to prove she was worth saving. It should have only required compassion, basic human decency, and the simple recognition of her humanity. Healthcare, a public good or private business? We provide public education, police protection, firefighting services, not because they make profits, but because society believes these things are essential. Why not healthcare? Why is education a right, but treating cancer isn't? Why is putting out fires a public good, but preventing someone's death from illness is negotiable? These questions expose America's fundamental ethical hypocrisy. We are all Michelle. It's tempting to believe Michelle's tragedy could never happen to you. But sickness doesn't discriminate. Eventually, it finds us all. If illness struck tomorrow, would your insurer approve your treatment? Would you trust your life to a system whose primary goal is profit, not healing? Or would you demand a system that prioritizes people above all else? The question we avoid asking. America fears the question of universal health care because it challenges deep-rooted beliefs: individualism, each person for themselves; capitalism, everything should generate profit; meritocracy, healthcare must be earned. But what's the merit in being healthy enough to live? Should someone's worthiness of medical care depend on their job, their wealth, or their luck? The healthcare myth: freedom of choice. Critics argue universal healthcare limits freedom, but what freedom exists in a system where insurance dictates your care, your survival, your dignity? Michelle had no real choices. Her insurer decided her fate. Is this freedom? Real freedom means guaranteed health care without fear of bankruptcy, eviction, or death. Real freedom means no corporation decides your worth. Redefining responsibility. We tell citizens, be responsible, pay your premiums. But why isn't society equally responsible? Isn't it irresponsible for society to let insurers profit by denying care? Isn't it irresponsible to let millions suffer bankruptcy due to medical bills? Personal responsibility should not be a one-way street. Society owes citizens a guarantee of health care in return. A moral awakening. America must decide if health care is a human right or a market commodity. Michelle died believing she failed. But society failed her first. America needs a moral awakening. Acknowledging healthcare as a universal right, prioritizing human life above corporate profit, ending the cruel calculus that says a life-saving biopsy can ever be not necessary. Final reflection. The legacy we choose. We can choose compassion, or we can choose profit, but we cannot choose both. Michelle's story isn't rare. It's commonplace. Until America makes healthcare a right, countless more Michelles will lose homes, savings, dignity, and lives. We must ask ourselves, what legacy do we want to leave? One where profit margins decide who survives? Or one where human life is priceless and protected? Michelle Reed deserved better. America deserves better. The choice is ours. Michelle Reed's life ended at 42, but her story is far from over. It lives in the silent rooms of cancer patients denied care, in the desperate eyes of families crushed by medical debt, in the exhausted voices of doctors fighting against bureaucracy. Michelle's death was preventable. Her financial ruin was avoidable. Her pain was not an accident. It was a choice our system made every step of the way. She played by the rules, paid her premiums, trusted the system. The system betrayed her. Michelle wasn't weak. She was brave. She fought not only cancer, but a healthcare machine built to profit from suffering. She died believing she had failed, but the truth is clearer now than ever. Michelle didn't fail America. America failed Michelle. What will you do now if Michelle's story shook you? Good. If it outraged you, even better. But if it inspired you to act, then Michelle's legacy lives on, because stories alone won't fix this broken system. Awareness alone won't end medical bankruptcy. Change requires always action. Raise your voice. Share this story. Let Michelle's experience become impossible to ignore. Speak about healthcare openly. Challenge the idea that illness should mean bankruptcy. Hold leaders accountable. Demand they protect lives, not corporate profits. Your silence benefits insurers. Your voice benefits people like Michelle. Demand real reform. Contact your representatives. Demand healthcare be treated as a human right. Support candidates who prioritize Medicare for all or true universal coverage. Reject politicians funded by insurance and pharmaceutical lobbies. Change won't come from corporate boardrooms. It will come from you. Join the movement. Support groups fighting for universal health care. O physicians for a national health program. O National Nurses United. O healthcare. Now. Your participation turns pain into power, tragedy into transformation. Redefine responsibility. Michelle took personal responsibility every step of the way. Now, it's our turn. Let's redefine personal responsibility to include society's responsibility to ensure healthcare is a human right. Let's refuse to accept that anyone's life depends on their insurance card. Let's demand healthcare as a guarantee, not a privilege. Envision a better America. Imagine an America where Michelle never faces bankruptcy because of illness. Imagine never again needing a GoFundMe to afford chemotherapy. Imagine doctors, not accountants, deciding your treatment. This America isn't impossible. It exists everywhere else in the developed world. It's our choice to make it real here, Michelle's legacy. Michelle Reed didn't ask to be a symbol, but her struggle became ours, our responsibility, our shame, and now our hope. Michelle's fight ended, but ours is just beginning. We cannot undo her tragedy, but we can stop it from happening again. A final promise. To Michelle and to millions like her, we promise we will not remain silent. We will not accept healthcare driven by profit. We will demand better for ourselves, for our children, for Michelle. Because healthcare is not a privilege. It's not negotiable. It's not optional. It's a right. Act now. Michelle Reed's story must end differently. Share this video now. Your click matters. Comment below with your story, your outrage, your determination. Subscribe and follow Powerline Stories for more urgent truths. Together, let's rewrite the ending of this story. Let's ensure Michelle's voice echoes, not in silence, but in a movement powerful enough to change the world, because no one should die from profit-driven healthcare. No one. Not now, not ever again. This was Michelle's story. This is America's story, and now it's yours. This is Powerline Stories. Truth is power. Use yours.